When working with an individual who experiences panic attacks, one of the very first things I would do is help them understand what's actually happening inside of their brain and body during a panic attack. So in short, I would teach them about our natural survival mechanism called the fight or flight response. Okay, so this is our biological drive to either fight off or flee from danger. So the physical changes that happen during the fight or flight response allow an individual to survive. Okay, however, a panic attack is basically this fight or flight response occurring when we're not faced with a life-threatening situation. It's essentially a false alarm being triggered, all right? So I believe that by helping an individual understand this natural response and what's actually happening during a panic attack can really help, because it kind of takes the crazy out of it and helps the person make sense of what's happening to them. Okay, so then I would go on to ensure that a person knows that even though panic attacks feel really horrible and like something terrible is happening to them, like a heart attack, in actual fact, a panic attack can't physically hurt them. It just feels like it, all right? Then I would make sure that a person is really well versed with breathing from their abdomen, okay, because this is really beneficial for helping to calm that fight or flight response down. This is because when we have a panic attack, we tend to take a lot of short, shallow breaths from up here in our chest, and that just tends to exacerbate the anxiety, all right? Finally, one of the things I would do really early on is make sure I teach somebody how to ground themselves during a panic attack, because this can help reduce panic significantly in the moment and help it pass a lot faster. So what I mean is I get the person to use their 5 senses, or I tend to do 3, so hearing, sight and sound, to help ground them. All right, so I might, for example, get the person to, in the moment, name 5 things that they can see, 5 things they can hear, 5 things they can touch. So what this does is this can help a person shift their focus from all of the uncomfortable sensations that they're experiencing in their body, as well as any distressing thoughts that they might be having during the panic attack.